Yes, you can prepare for 3 minutes. So I have given you already the time, but this is for the people who are watching the video.
Okay.
So you can just go through the paper. Hello and welcome to Seven Sentinels. This is Grandmaster class, and I am Peter Simon with you. Hello and welcome to Seven Sentinels. This is Grandmaster class, and I am Peter Simon with you. Today we are conducting a speaking session, and we have here with us Omotoye Toyin, and she is from Nigeria, currently in the UK. She is preparing for her exam, which is scheduled on 4th of May, and it's an intensive session. Yes, Omotoye, once you are ready, you can start.
Thank you, sir. Good morning.
Good morning,
Yes,
nurse.
I'm the community nurse. I came to second you to help you in insulin injection administration. How are you feeling today?
Yeah, actually, I'm a bit anxious and I'm nervous. I'm not sure whether I have to take insulin injections or not. I'm a little puzzled. I have been managing well with my diabetes diet, medication regimen, and exercise program. Why did this doctor suggest taking insulin injections? Going on well. What's the problem?
Okay. That can be understandable. I can understand you with being anxious because it is injection. I want to assure you that you should not be too worried. It's going to take a few seconds, and I'm going to explain in details how the process is going to take to you, which will give you it will give you more understanding about the administration, so you don't have to bother yourself much over it. And it take few seconds to get it administered. It work faster than those taking tablets, and it will help you to control your diabetes level, blood sugar level within few minutes. But you need to be regular with the drug administration. Is that okay?
That's really fine. But the thing is, I am pretty much, confused. I just don't really like the thought of injecting insulin all by myself. How is that possible? I'm not a nurse. I'm not a professional. So how can I take it?
Oh, I can understand your level of anxiety, but insulin administration is not only administered by a nurse. You can do that on your own, but it's going to go through under supervision and teaching, and that is the purpose of my coming to you today. So I'll put you through on how to administer it and how to couple the syringe to withdraw this insulin on its own, and how to administer it. Then you need to rotate it. You won't continue to administer on the same spot each time. So by doing that, you will have less pain. So and when you got used to it, the fear will be disappear. You will be confident in yourself in administering it. Hope you are okay by that.
But the thing is, I want to ask you one particular thing. Is there any other way to manage my diabetes other than taking insulin injections?
Thank you. There are diverse ways of which insulin diabetes can be managed, but as you can say, you said previously you have been managing it with medications and diets, but because the blood sugar was not stable, that was why your doctor prescribed the insulin for you. So you are still going to be on this insulin for the meantime. And when the blood sugar level is being well controlled, then you can be take off gradually. It depends on the level of your compliance with the insulin administration and your regimen diet, the diet intake. So purposely everything work hand in hand. So if you cooperate well with the laid down policy on how what to do, you have less time and the taking of insulin administration might not be for long, then you wean it off and go back to the regular oral hypoglycemic and diet. Is that okay by you?
That's very fine. The information is very clear. I can understand. But the thing is, okay, fine, agreed. Now I feel better about the injections now. Can you please explain me the procedure? What should I do? And how should I take the injection? Should I take use the same needle every day, or should I take the injection at the same site always? What was the
Thank,
procedure?
thank you. The procedure is to use same vial but not the same needle. Then you will be given a particular dosage to be take by your doctor, which is what we are going to follow. Then when you pick the lancet or the syringe at when you pick the insulin syringe, so you are going to withdraw the quantity, the particular amount that is being prescribed by your physician is what you withdraw. Then before then, you make sure you wash your hand with soap and water, make it dry so that you will not contaminate the tip of the insulin syringe and the needle. So when you clop up the needle, you are going to roll it and make sure it is very lock. After that, you prime the insulin to make sure that you are not having excess insulin or air into the valve. So when you prime it like 1 to 2 mils, just you express that out. So when that is out, then you regularly withdraw the particular amount that is being prescribed for you. So after which it is confirmed, you press the syringe. If you want, you can use different part of the body, either your upper arm, your navel, or your thigh. So you choose the particular place. But for you, I will ask you to use your I will encourage you to use your tummy. Then you start from the 2 finger below your navel. Then you make sure you rotate it. You don't use a particular place for a longer time. So when you do right side today, you can change to the left side the other tomorrow. So by doing that, you won't have pain on the site of injection or any redness at the site of the injection. Then when you put in the needle, you you make sure the needle was in. Then after pressing it, then you hold on for about 10 seconds before you pull out the needle. So by then you will not waste out the insulin that's supposed to go into your system. So after which everything was over, then you remove the needle, you cover it and put it back. Then the next day you are going to use another needle entirely. So each needle is used and discarded, and you are going to have a sharp box with you, in which you are going to put each of the needles used into the sharp box. Is that
Y-
okay?
Yeah, that sounds better. Now I'm ready for you to watch me giving
Okay.
myself an injection.
Okay.
Yes, you can observe and you can tell me.
Okay.
Thank you
Bring
very
out
much
your
for the information. I am very much pleased. And what about these used syringes and needles? What should I do with them?
you are going to put inside this star box that is being provided for you here. So when it is two-third of the level, so we are going to clip it and pack it and close it. Then another pack will be given to you, and this will be collected by us and take for incinerating. So you just have to be safe with it so that it will not injure you or injure anybody. So that's why this sharp box is being provided for you.
Right, that's very nice. Thank you very much, nurse. It was very much
Thank
convincing.
you.
You have helped me a lot, give a lot of information. Thank you once again.
So your fare is now early now, and you're able to you can do this on your own, right?
Yes, of course.
Okay,
But
I'm happy about that.
if I have any doubt, I'll call you for 1 or 2 days. Then afterwards, I'll take it on my own.
Okay,
Right. Now let me give you the feedback. Omotoye Tonin.
yes, sir.
Okay, you are saying ah. So you are using this a number of times. So you have to avoid this one. Uh, So you can just zip your mouth, You can just zip your mouth. You can close your mouth instead of opening mouth and making some sounds. You can close your mouth so that the sounds will not come out of your mouth. The
Mm,
next one is unnecessary sounds. Yeah, you can avoid those. And you said it's depend. No, it depends. It depends. DEPENDS. It depends. You're saying it's depend. So instead of putting s to depend, you're putting s to it's. So that's
Okay.
wrong. Next one, you said everything work. Everything work. No, everything works. Everything is singular. So you have to say next word should end in s. Everything works.
Okay.
Everything works. Not everything work. Everything works. Next one. You sound very confident while speaking. Initially, that confidence level was not there, but by the time we reached 40% of the speaking session, that means after 2 minutes, you gained that confidence and you recovered, and your fluency was excellent, and everything was going on well. That's really very fine. That's really very, very fine. That's what I'm telling you. The
Thank you.
next one, uh, fluency. Yeah, you improved a lot, though you have failed in the beginning first minute, utterly failed, second minute little covered, but third minute onwards you ruled the thing. You are speaking very confidently. That's what is your confidence is working. So when you work confidently, everything will be fine. Remember that everything will be excellent, no doubt regarding that one. Then idea generation, how you are generating your idea is more important. So for example, if you want to generate some ideas, first of all you should have the subject context. Subject, if you have the subject, you can generate ideas. If you don't have subject, generating ideas will be very difficult. Otherwise you have to make up something. So you have the idea, you have to talk about all the points. You have already 3 minutes to prepare. So prepare well in that 3 minutes time and be ready what points you have to talk. For example, you have to talk about the injections, the sites of the injections, where you there are 5 sites, the two arms and the two thighs, and then area around the umbilical cord. So belly button, whatever you say. So which is these are the things you have to speak. Then afterwards you should rotate these sites on a daily basis. You should not take repeated in order to avoid bruising or rupture or any sort of inflammation. So you have to avoid these things. This is what you can speak. And then what next you can speak is using the needles and syringes. So it can be, um, using the syringes, the same syringes every time, or you can say use and throw syringes. Okay, use a
Okay.
single use syringes and needles. So you can just use and you can throw it off. Otherwise there are different types of needles also. You are the pin needles, pin syringes, which just press the pin and the insulin will be taken. Otherwise you can use the normal syringe. Okay, and you have to plunge the insulin into the body. Right. And how you have the procedure, how you have to start wiping the area clean, then afterwards, pinching something, the skin, and finding out the place where exactly you have to insert the injection needle. So then after that, putting it at particular angle, and afterwards, giving the injection or sending the insulin into the body. Okay, and then afterwards removing it as it is in the same manner how you have given, um, and then do not rub or anything, just leave it for like that. Okay, so whatever that process you have to tell, and after that you have to tell how you are going to dispose the used needles and syringes, or if the same needles and syringes you are using, how to heat them and sterilize them and put them aside, and after using and again sterilize before using. Okay, so this is how you can talk about that, and how the used needles and syringes should be dumped into the disposable container.
Campus. Yeah.
So how it should be, that also you have to talk. All these things, it's very important. So if you have this subject knowledge excellently well, then okay. Then next one, there is a reassurance part. There is a confusion. There is a doubt on the part of the you say the person who is taking the counseling session with you. So he has some doubt. He is not confident. So you have to give him reassurance. Yeah, what you sound perfectly right, because if I were in your place, I would have behaved in the same way. But trust me, there are many patients who have taken these insulin injections and are taking on a regular basis. The only difference is others are not taking insulin injection, normal people, and the people who are suffering this problem. okay, diabetes, they are taking insulin injection and they are leading the life normally. Only the difference is they are taking insulin injections because the body cannot produce on its own in a normal process. So artificial method of taking insulin is practiced. So otherwise everything is common. Okay, if you do not take these injections on a regular basis, complications may arise, and the situation may deteriorate and the conditions cannot be reverted. So better prevention is better than cure. So taking the medications now will avoid any such complications in the near future.
Sure.
So this is the way how you can talk. You
Okay.
have a lot of things to speak. So, okay, you can
Yes,
speak,
sir.
but you have the subject only on this area you have to speak. Other than that, nothing else. So you're doing well. That's perfect. And what all I have given the sentences, you can go there to the video I have recorded and put it on the YouTube. You can note them down. And how Sar is speaking, what are the sentences he's speaking, just like that. You listen to them and you can make some notes. You need not make some notes. You can just to go for that. What is that? Mm, transcription. Transcription. What all speaking will be transcribed. You can take that one copy and you can just yeah, use them. Right.
Yes,
That's
sir.
fine. You're doing
Okay.
very well. Now you prepare for the second card and I'll call you after some time. Okay.
Okay. Okay, sir.
Prepare for the second card and message me. Then again, you can come here. So that's the end of the session. Okay. If anybody is interested in these sessions, you can contact me. You can leave now, Omote.
Okay, sir. Thank you, sir.
Yeah. So, yes. If any one of you are interested for subscriptions, these are, yes, this is Grand Master Class, and I'm Peter Simon with you. These are our regular sessions. This is how we conduct speaking sessions. And if you are interested to have our regular sessions, and if you are really, really, really serious, then only approach me. Otherwise, yeah, you can practice on your own. If you're really serious, if you want to clear in the first attempt, do struggle, hard work, and if you have time to give me, and then only I can. So don't think that it's just 5 minutes. It's a feedback and correction and evaluation daily. You have to do 1 or 2 speaking sessions on a daily basis. And if you're weaker and you're have to do even 4 or 5 sessions, okay, sometimes even 6 or 7 sessions if necessary, because I want you to clear your test in the first attempt. So then only you contact me. And this is my number. Contact for subscriptions +91 98 778 67360. We also have writing feedback and listening and reading subscriptions. You can contact me for the full course, 1 month, 2 months, or 100 days program, individual skills or multiple skills, or all the 4 skills. However you wish, you can just contact me on this number. I repeat, +91 98 778 67360. Grand Master Class